Maria is a former nurse, a refugee, and a patient trapped in a room she can barely leave. Scans confirm her physical back injury healed completely over a year ago. There is no structural damage left to repair, yet the agony remains severe enough to keep her entirely bedridden. To understand why, researchers use the Biopsychosocial model, or BPS. It maps human pain across 3 overlapping variables: our biological bodies, our psychological state, and our social environment. Modern medicine often treats humans like machines with broken parts. You find a fractured bone, and you cast it. But when the physical parts are intact and the pain remains, that mechanical approach hits a dead end. This points toward a condition called central sensitization, where the nervous system remains permanently hypersensitive to normal, everyday stimuli. Think of it like a building's fire alarm. The firefighters came, they put out the flames, and the structural damage was repaired. But the alarm's internal wiring is stuck in the on position. Maria isn't imagining her symptoms. The alarm is screaming, and while the trigger has changed, the sensation remains physically real. Once the nervous system is stuck on high alert, psychological factors act as direct fuel. Depression, anxiety, and past trauma keep the brain constantly scanning for threats. For Maria, the relentless physical pain leads to severe insomnia. Night after night of staring at the ceiling frays her nervous system further. Her anxiety over never recovering causes her back muscles to physically clench and spasm, aggravating the area. The result is a closed loop. The physical pain causes immense psychological stress, and that stress generates the physical pain it is afraid of. The nervous system attacks itself. The loop expands outward into the patient's environment. Chronic illness drains bank accounts, ends their careers, and isolates people from support networks. Sociologists track this through social stratification, the way society groups people by wealth and status. Marginalized populations, like refugees, often lack health literacy and adequate insurance. They are consistently pushed to the bottom of healthcare priority lists. Then there is role theory. We build our identities around the roles we play. When Maria's illness prevents her from caring for her children, she loses her primary identity as a mother. That loss of purpose accelerates her depressive spiral. Add in cultural stigmas against seeking mental health treatment, and patients are often forced to endure this entire cascade of losses in complete silence. A patient's physical recovery is dictated heavily by these external pressures. A calm, well-funded environment promotes healing, while poverty and isolation guarantee the nervous system stays locked in survival mode. This exposes a gap in modern clinical practice. The average primary care visit lasts roughly 15 minutes, which is rarely enough time to address anything beyond a single physical symptom. Standard healthcare fails Maria by treating only her back. A doctor hands her a prescription for opioids and sends her out the door, leaving her trauma, her recent job loss, and her deepening isolation completely unaddressed. Pills might dull the sensation temporarily, but treating only the biological tissue leaves the root causes of central sensitization untouched. The alarm will keep ringing as long as the psychological and social fires keep burning. This flowchart outlines a comprehensive chronic pain management protocol. Built on the EQUIP framework, it maps an 8-week path addressing a patient's entire life context. Instead of just rating pain, nurses document social determinants of health, screening for food insecurity, trauma, and systemic dismissal. This protocol incorporates pain neurophysiology education. Medical professionals teach patients the fire alarm analogy, helping them understand their nervous system so they can move without fear of further structural damage. Nurses also act as systemic advocates. By connecting patients with peer support groups, counseling, and financial assistance, they actively rebuild the patient's social safety net. By addressing these external factors, Maria's trajectory reverses. Peer support ends her isolation. Psychoeducation reduces the anxiety of movement. As her environment stabilizes, her nervous system finally calms down, and the fire alarm shuts off. Chronic pain sits at the intersection of biology, psychology, and sociology. Repairing the body requires addressing the trauma, class structures, and environments that surround it. Healthcare succeeds when it looks past the symptom and commits to healing the human mind and the society they live in. If you've ever felt dismissed or ignored by the healthcare system when trying to get help for pain, share your experience in the comments. Be sure to like and subscribe for more deep dives into the science of health.